The Correctional-Association-of-New York was created in 1844 by people concerned about abusive prison conditions and how former prisoners would be reintegrated into society. We are unique. In 1846, New York State granted the CA legislative authority to monitor prisons and report its findings to the public. We are the only such organization in New York, and one of only two in the country. We are the only one that advances systemic reform. Since its founding, the CA has grown into a dynamic and innovative force for progressive change. Driven by a deep belief in the inherent dignity of all people, we advocate for stopping the ineffective use of incarceration to deal with social problems, humane prison conditions for adults and children, and transparency and accountability in the justice system. The U.S. has the distinction of being the world leader in incarceration. 2.3 million people live in our prisons and jails. Recent data shows that 1 in 32 adults, over 7 million people, are incarcerated or on parole or probation. We spend more than $68 billion a year on prisons. Incarcerated people have dramatically higher rates of chronic diseases such as HIV. In New York, 83% have a substance abuse problem and more than 8,000 suffer mental illness. 90% of women in New York's prisons have endured violence in their lifetimes. The rate of suicide is disturbingly high. Prisoners are vulnerable to mistreatment by authorities who have limited accountability to the public. During a recent trip to Attica, I was acutely aware of a pervasive atmosphere of hostility and physical intimidation. Some of the most troubling realities of incarceration that we confront include pregnant women being shackled, children being subjected to physical abuse for disobeying guards, pervasive violence that is often racially motivated, isolation of people in solitary confinement, sometimes for 10 years or more, experiencing dramatic deterioration in their mental and physical health, women with histories of trauma subjected to persistent sexual abuse by guards, and patients with chronic painful conditions being purposefully denied pain medication. Far from rehabilitating people, prisons detract from public safety and are often an instrument for turning first-time offenders into lifetime criminals. In New York, more than 41% of adults are reincarcerated within 3 years of release. For incarcerated children, nearly 71% of boys and 32% of girls will spend time in adult prison or jail. While data proves that access to college education dramatically reduces recidivism rates to only 4%, funding for such programs has been decimated. 95% of people in prison will ultimately leave. Individuals return to our communities debilitated and stigmatized with few or no employable skills, lasting psychological damage, and poorly equipped to make a crime-free reentry. In any other industry, doing the same thing over and over again and getting consistently bad results would force you to go out of business. But the business of incarceration has proven time and time again that it is a failure. The CA is an independent, nonpartisan organization that advocates for a more humane and effective criminal justice system and a more just and equitable society. We believe that all struggles for justice and dignity are connected, and that race, gender, and economic injustice are deeply intertwined with the power of the prison system over people's lives. Incarceration has had a devastating impact on communities of color. In New York State, 75% of people in prison are Black or Latino. For Black males in their 20s, 1 in every 8 is in prison or jail on any given day. These trends have been intensified by the disproportionate impact of the war on drugs, in which 3/4 of all people in prison for drug offenses are people of color, when data shows that the majority of drug users are white. Because of these dramatically discriminatory rates of incarceration, every single issue we tackle has an impact on the racial disparities in our justice systems. Our work is informed by the relationship between incarceration and the consequences of inequality, including gender-based violence, homophobia, and inadequate access to quality health care, affordable housing, living wage jobs, education, child care, and other social supports. Our main objectives are to stop the misguided and ineffective use of incarceration to deal with social problems, downsize the prison infrastructure, and increase funding for and the use of community-based alternatives for adults and children. Promote transparency and accountability in the justice system, and hold government and prison officials responsible for reform. Ensure that conditions in the prisons are humane and that the rights of incarcerated adults and children and their families are protected. Promote effective prison health care and programs that actually rehabilitate people, are age and gender appropriate, are grounded in best practices, and prepare prisoners for successful reentry. Change the power dynamics of policy making and provide training, support, and opportunities for the people most affected by incarceration to become leaders and active participants in efforts for reform. Educate the public and policymakers about key criminal justice issues affecting prisoners and their families and conditions inside the prisons. We have information. Our unique access to prisons gives us firsthand knowledge of the system. No one else can do what we do because no one else can see what we see. We are sought out by the government and other advocates because we give credibility to the systemic nature of a problem. We are watchdogs for the whole system, from prisons to politics. When people in power are making decisions about criminal justice policy, our immovable presence is felt. We have longevity. Criminal justice organizations historically have a short life, and elected officials have frequently come and gone during the CA's nearly 170-year history. We have been one of the few constants working on these issues, stability and reliability, that is rare in the nonprofit world. We have the institutional memory of what has worked and what has not, and the experience to counter a prolonged opposition and engage in the extended uphill struggle to create lasting change. We are independent. We work to ensure the system is transparent and accountable to the public. We are observers, critics, and proponents for better government. We rely almost exclusively on private funding. Our independence allows us to carry out our mission without fear of reprisal. We have a credibility and steadfastness that makes it impossible to dismiss us. Policymakers, the press, and other advocates all know they can trust our information. Our advocacy is always well documented, fact-based, and principled. We access the levers of power. We have strong relationships with people in various government positions. We work to leverage that access to most effectively advance change. We are values-driven. We know that when you incarcerate a person, you imprison a family and an entire community. That a criminal justice system that degrades and demeans some members of our society degrades and demeans all of us. We promote solutions and take action. Reducing incarceration and reforming entrenched prison cultures require complex solutions. We identify the systemic nature of the problem and utilize all of the tools at our disposal to promote credible and realistic solutions. For example, we found New York State was reimbursing localities for locked youth facilities, but not for community-based programs that are cheaper and more effective at preventing recidivism. The CA successfully advocated for a new funding formula. Community-based programs are now reimbursed at a higher rate than locked facilities. We have a proven strategic model. Advocacy and movement building are not simple things to measure, but over the decades, the CA has developed deep institutional knowledge of the indicators of progress towards lasting reform. The CA brings a unique combination of wisdom and experience. We do not simply engage in rhetoric, but propose solutions that are evidence-based and politically viable and remain steadfast in promoting the dignity of the individual. Lastly, the CA has an exceptionally dedicated, skilled, and knowledgeable staff that is highly respected and deeply committed to the organization's mission. Everyone at the CA understands our purpose, why we are here, what we're fighting for, and how we define success. Key to our sustained effectiveness is that we are well managed and our finances are strong and stable. To carry out our program, the CA has three main projects. Juvenile justice works to reduce reliance on incarceration for children who commit crimes and to advance effective policies that treat children who come in contact with the system as children and decrease recidivism. Prison visiting carries out our unique legislative authority to monitor men's prisons. Women in Prison addresses the effects of the state's criminal justice policies on women and their families and monitors conditions in women's prisons. Our projects utilize the CA's proven effective strategic model. We conduct independent oversight of the state prisons, making us unique and essential. We are one of only 2 private organizations in the country and the only organization in New York with the authority to go into prisons. We take in teams of volunteers and staff to interview prisoners, administrators, and prison staff to get first-hand information about what's going on behind the walls. We publish reports, fact sheets, and policy papers. We coordinate public forums. We issue press releases, publish op-eds, and seek editorials in major news outlets, and we participate in conferences and panel discussions on our various issues. We build strong working relationships with key policymakers and government officials. CA staff hold positions on advisory groups, review boards, and task forces, which allow us to participate in decision-making and shape policy. We build the leadership of people most directly affected by criminal justice policies. We run programs for formerly incarcerated women and youth to provide them with the skills and knowledge to become leading advocates. We build coalitions. The CA actively mobilizes formerly incarcerated men and women, their families, service providers, and other advocates to advance our agenda. We reach out beyond the criminal justice arena to experts in other fields who are addressing the myriad of issues that people involved with the criminal justice system experience. For example, our Coalition for Women Prisoners, a statewide group with 1,600 members, collaborates with domestic violence advocates and service providers on its Domestic Violence Survivors Justice Act, a campaign to change sentencing policy for people who commit crimes as a result of abuse they have suffered. Most women in prison have histories of trauma or abuse. We educate policymakers and advocate for change. In cases where only legislative action can affect needed improvements, we draft and promote new bills, seek sponsors in the State Assembly and Senate, educate policymakers and elected officials through advocacy days, hearings, phone calls, email campaigns, and meetings, and build support through public education and press outreach. We monitor the implementation of new policies. No policy, no matter how progressive, can have positive impact unless it is carried out properly. Once we successfully advocate for the passage of new law, we closely monitor its implementation to address any barriers and ensure it is carried out effectively. One primary measure of success is passage and full implementation of systemic policy change. 2 recent examples are the Special Housing Unit, known as the SHU, the SHU exclusion law, which requires appropriate treatment for people in prison with mental illness and limits their isolation in solitary confinement, the Adoption and Safe Families Act, or ASFA, expanded discretion law. This new law provides foster care agencies with more discretion and permits them to not seek termination of parental rights for parents in prison who have children in foster care. We inform and advance the public debate. We measure if our talking points are echoed and our issues receive widespread attention. Government agencies adopt our language as their own, and if the public demands reform on an issue that may have been ignored years ago. We are visionary. A metric of our success is how many times we can say our initiatives are the first in the country, creating an effective mode that can be replicated. For example, our Domestic Violence Survivors Justice Act campaign, the significant advances made by the anti-violence movement over the last 30 years have stopped short of reforming the unjust ways in which the system punishes DV survivors charged with crimes directly related to the abuse. The DV Survivors Justice Act would 1. Give judges discretion to sentence survivors whose abuse was a significant contributing factor in their crime to lower sentences, and in some cases to community-based alternatives to prison. And 2. Permit currently incarcerated survivors to apply to the courts for resentencing and earlier release. This new law would be the first of its kind and a model for the country. We give voice to the people inside. Their belief in us, that we are a voice for their concerns, and that we work to make sure they are heard, and their willingness to get involved is a measure of our success. Our credibility with stakeholders and our recognized expertise are measured by how much we are sought after for information and intervention. We regularly receive calls and letters from family members and incarcerated people, concerned citizens, and sometimes even facility employees, informing us of abuses and troubling situations that exist throughout the prison system. And we are the go-to resource for facts about the criminal justice system for policymakers, press, advocates, academics, and other interested people. Our consistent presence in the prisons as monitors undoubtedly has an effect on the conditions in those prisons, if for no other reason than because they know that we're watching. To see what the system would look like without our oversight, you can look at failing systems in other states, Georgia, Ohio, and California. In these states, prisoners were engaged in prolonged hunger strikes to draw attention to the inhumane conditions to which they were subjected. We are visionary, strategic, and unique. We are known as effective advocates. What is not as apparent is how we build these campaigns, such as our work to ban the shackling of women during childbirth. We heard during prison visits and in letters that women were being shackled during childbirth, horrifically endangering the life of the mother and child. Officials denied it, but we were uniquely positioned to provide evidence, including testimony from women who had been shackled. We organized in the community, medical providers, and national experts. We did extensive research, examined policies in other jurisdictions, and determined that legislation was necessary. We collaborated with legislators, identified bill sponsors, and contributed language for the bill. The Coalition for Women Prisoners designed a campaign to counter obstacles to passage of the law. We took women who had been shackled to the Capitol to tell their stories to legislators. We received supportive media coverage, including an article and editorial in the New York Times. The bill ultimately passed, nearly unanimously, but the governor's support was uncertain. Over the next several months, we held demonstrations outside of the governor's office. At the final rally, he addressed the crowd and committed to signing the legislation, which he did later that month. We now monitor the law's implementation. We are not a government agency. We are not appointed or elected to represent the people. We are the people. We are funded almost entirely by private donations and have been for nearly 170 years. We do not provide direct services. This mission-based decision allows us to maintain independence and objectivity. We hire, promote the leadership of, and fully integrate formerly incarcerated people into the CA staff. Our outcomes are outsized to our capacity. People are amazed to discover the relatively small size of our staff and budget. There is a direct correlation between the talent of the staff and the CA's remarkable track record. Our programming is diverse. The CA is different things to different people, a strength that reflects our broad spectrum of strategies. Many people know us as the Monitor Watchdog or Criminal Justice Think Tank. Others know us for our frequent commentary in the press. We are also a vibrant, collective organizing group that mobilizes people who are not professional advocates. We coordinate 3 active, well-respected coalitions and leadership training programs for formerly incarcerated people. We look not only at the system as a whole, but its impact on vulnerable populations, women, children, gay and transgendered youth, people living with mental illness and HIV, the poor, and people of color. Many people know us as an independent prison monitor, but fewer know how that role has increased in sophistication and impact. Recognizing the unique needs of women, we launched a special initiative to monitor women's prisons. Both the men and women's monitoring programs have become more rigorous in their methodology and increasingly focus in depth on issues like substance abuse treatment and reproductive health care. Throughout our history, the CA has informed public discourse on a range of criminal justice issues and helped bring about major reforms in just the last 5 years. One of our most notable achievements is our campaign to reform the Rockefeller drug laws. Their passage in 1973 set into motion an explosion of the prison population in New York, decimating low-income communities of color. The result of our reforms was a significant drop in New York State's prison population, leaving a large number of empty beds maintained at taxpayer expense and presenting an opportunity to turn back the tide of prison expansion. Subsequent to our advocacy, the governor made the historical decision to close a number of both adult and youth prisons. We successfully advocated for the creation of a family reunification program at New York's largest women's prison, located 8 hours from New York City. This has gone a long way toward allowing mothers to maintain bonds with their children and families. Parents in prison who have children in foster care face serious challenges meeting their legal responsibilities to preserve their parental rights. The CA successfully pushed for a new state law allowing foster care workers discretion to delay filing for termination of parental rights if a parent is incarcerated or in drug treatment. An alarming percentage of incarcerated people suffer from serious mental illness, and many have a difficult time following orders and controlling their behavior, often landing them in solitary confinement. The CA issued 2 major reports on the issue and launched a successful campaign to mandate appropriate treatment for incarcerated people with mental illness and limited their isolation in solitary confinement. The CA was the first group of its kind in the country to address the harassment and abuse of gay and transgender children in youth prisons and achieved a landmark anti-discrimination policy to protect and support them. The CA is now assessing the policy's impact through visits to youth facilities, the first time in New York an advocacy organization has been granted this access. New York has the highest percentage of prisoners living with HIV of any state in the country. Until recently, health care in the prisons was not monitored by the Department of Health. We helped lead a campaign that successfully mandated the Department of Health to oversee HIV and hepatitis C care in prisons. Children involuntarily involved in the sex trade are tragically often treated as criminals, not victims, despite not being able to legally consent to sex. With its allies, the CA successfully advocated for the passage of the Safe Harbor Act, legislation preventing New York from prosecuting sexually exploited children on prostitution charges. Shackling a woman in labor during childbirth and in recovery is cruel and inhumane. With our allies, we achieved a new state law forbidding use of restraints on incarcerated women during labor, delivery, and recovery, and placing restrictions on how prisons can shackle pregnant women going to and from the hospital during delivery. The CA's most significant challenge by far is the lack of political support for our issues. The facts prove that alternatives to incarceration and investments in education and community development are cheaper and far more effective at reducing recidivism and preventing crime. Yet, the politically expedient tough-on-crime ideology pervades in a way that actually harms communities and is counterproductive to public safety. The truth remains that the constituencies and communities with the highest rate of incarceration have the least money and political power. The people on whose behalf we work cannot vote. The families of incarcerated children and adults are often severely lacking in financial resources. Frequently, the traditional tools of political organizing are not available to them. There's also frequently a vested economic interest in keeping people incarcerated. Entire communities are built on warehousing people, including children. Incarceration has become a jobs program in this country, and politicians are all too often more willing to invest money in building prisons than in building communities. But we have seen progress recently in New York, with the governor condemning this practice and taking steps for the first time in New York history to meaningfully reduce the state's prison capacity. A theme that is fundamental to us is respect for the individual, for the people inside and their families. It is a constant battle that we wage. The stigma of incarceration is so powerful, and the animus for people who are or have been in prison runs so deep that prisoners are very often viewed as less than human. Unfortunately, government leaders and the media are often complicit in promoting this attitude. The CA has grown significantly over its lifetime, from an all-volunteer operation to a professional staff of 20, and has grown its budget exponentially to support that expansion. While we have been very fortunate to build partnerships with enlightened philanthropists and private foundations over the years, one of our greatest challenges is sustainability. Our work is generally not politically popular, therefore securing funding to support our programs is a constant challenge, simply because of the few dollars that have historically been available to support advocacy for prison, juvenile, and criminal justice reform. The system and the public are ripe for progressive change. We see what needs to be done, we know how to do it, and we need the funds to build our capacity to do it. The CA is rich with information, experience, and wisdom, all unique to us, and has become a nationally sought-after expert on criminal justice issues. But we lack the capacity to fully realize this enormous potential. We also play a critical role in educating the larger public, not just in New York, but across the country, about prison and criminal justice issues, and have the potential to advance the conversation about mass incarceration and prison conditions. We hope to expand and modernize our communications tools and staffing to meet this significant need. We would expand and deepen our monitoring program for both men's and women's prisons. We would purchase more sophisticated data management tools and have the staffing capacity to analyze and process the data. We would conduct more visits and launch an outcome evaluation program for each facility visit, a program that has been designed but which needs funding. We would nationally promote the CA's model. In its 2006 report, the Federal Commission on Safety and Abuse in American Prisons recommended independent oversight of prisons. Citing the CA as exemplar, it recognized that the key to more accountable institutions is to educate and involve the public and invest in external oversight. Sharing research and firsthand observations about New York's prisons that no other non-governmental entity nationwide could offer, the CA's expert testimony to the Commission showcased us as a potential model for a monitoring agency. In addition to our unique prison monitoring experience, the CA offers expertise in a number of areas and has created mechanisms and solutions for change that are highly sought after and that could be replicated. New York is one of 2 states that automatically prosecute all 16 and 17-year-olds and 13, 14, and 15-year-olds accused of certain crimes as adults. These children may be subject to lifelong criminal records, and 16 and 17-year-olds face time in adult prisons, both of which increase recidivism. Research also demonstrates that children housed in adult prisons in the U.S. are 50% more likely than adults to face an armed attack from another prisoner and twice as likely to face staff physical assault. Youth housed in adult prisons are 5 times more likely to be sexually abused than children in youth centers. The CA is a leading advocate on this issue that is receiving widespread public attention. Additional resources would allow us to launch a robust statewide campaign to ensure that children who pose no risk to public safety remain out of the justice system and instead receive appropriate mental health, educational, substance abuse, and other services. We would also expand our leadership development programs for people most affected by prison policy to serve more women, launch a new program for men, and relaunch our program for court-involved youth that was terminated due to loss of funding. Lastly, the CA has grown significantly in recent years and needs to expand its infrastructure, fiscal, fundraising, administrative support, and technology that will be critical for sustainability. New York has become a leading example for the country. Over the last decade, it has reduced its prison population by more than 15,000, reduced prison spending, and reduced its crime rate by 25%. Proving that incarceration is not necessary to reduce crime, these results could set national trends. By reforming the Rockefeller drug laws, the CA actually changed paradigms around mass incarceration, and we believe aging prisoners and parole reform are the next horizon. Tough on crime sentencing and parole policies passed in the 80s and 90s are in large part responsible for greater numbers of people being incarcerated for longer stretches of time. Even as crime rates drop, the number of people behind bars remains high. Among the 2.3 million prisoners in the U.S. is an increasing number of aging prisoners, a group that now outpaces prison population growth overall. This is driven by the public's urge for retribution, and the graying of America's prisons mirrors the general population. But it's also driven by a lack of knowledge and understanding. Releasing older prisoners does not compromise public safety. Recidivism rates for younger prisoners range from 40 to 80%. However, research shows that recidivism rates drop drastically when people reach the age of 40. Recidivism rates for this population are less than 5%, and in some instances, 0.3%. Even with pervasively inadequate health care inside the prisons, it is exorbitantly expensive to incarcerate an older person, as much as 4 times that of a prisoner under 40. The factors which often lead to a person's incarceration, substance abuse, poverty, mental illness, domestic violence, are often the very factors which contribute to that person's advanced medical needs. Costs for maintaining someone under community supervision are dramatically lower. It is clear that we could take the older prison population, beginning with people in their 40s, and put them on community supervision with little to no risk to public safety. Not only would this be a smart fiscal move for our cash-strapped state, but a compassionate and more humane course of action for our leaders.